okay? And at the end, we can discuss what I forgot, okay? So that's the same thing. It is almost impossible to do everything and not forget something. But, you know, you don't get a full credit for it. So I wouldn't get full credit for it either. What we want you to do is practice so you don't forget anything so you get as much points as possible. But the average has been about 40 to 42 for students, okay?
If you forget something, can we forget it too?
If you forget something and we still have time, we will ask questions, okay? And at the end, when both of you have done it, then we will debrief and say what you have forgotten. The questions are, remember the things that we struck out? They're probably going to be related to that. Not, oh, what you forgot, because otherwise the second person has that advantage. Oh, yeah, I'm not supposed to forget reading number 2, or, you know. So we can't give hints away for the second person. So the questions are not related to what you forgot. They're just additional questions that we have on the sheet. Okay?
But if there's no time left over.
If there's no time left over, you probably did okay, and you just forgot.
You ask the questions, I mean, if the 10
No.
minutes is over.
No.
10 minutes
get
goes
points taken
fast.
off if
It does
you're
go fast.
over by
Yeah,
3 minutes or
my
something?
experience, and we talked about that last Friday, here to make an exam with you today. I'm going to start with your head and I'm going to end at your toes.
All right.
Okay, so I'm going to look at your skull. Any pain?
No.
No, good. I'm going to look at your skull. That's good. I'm not going to look everywhere, okay? That would be too much time. I'm going to look at your ears. The skin looks good. Ear here, ear here. Look at your temporal artery. I'm concentrating on one side and on the other. Very good. I'm going to look at your sinuses. Can you tell me if this hurts?
No.
No? Here?
No.
And here?
No.
Okay, look at your eyes. The sclera looks nice and white. I'm going to ask you, can you read this?
Yeah.
Last time here?
Is there enough evidence to report her to APS?
Very good. Do you use glasses?
Yes, I do.
Okay. How about smelling? Do you smell? Can you smell the coffee in the morning?
Yes.
Very
Yes.
good. I'm
Yes.
going to look at your eyes and see if they can straight, okay? Very good. Excellent. The other side. Good. Good. Now I'm going to ask you to follow my light. Keep your head straight and follow my light. She knows what I'm doing, so she's going ahead of me. Okay, very good.
I didn't move my head.
And I got my cotton somewhere. That's bad acting, isn't it? There it is. Can you close your eyes and tell me if you feel this?
Mhm. Yes. 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 Yes.
Okay. Now that was 5. Can you make a face and smile to me? Puff your teeth. Very good. Now can you open your mouth and say ah? I'm looking at your gums as well. Very good. Can you stick out your tongue? No? Nice. Well, can you swallow? Okay. Her trachea is in midline. I see no pulses, no venous distension. I'm going to look at her lymph nodes right now. I'm going to start in the back. Behind the ears. In front of the ears. Preauricular ones. Submandibular. Segmental. Anterior ones, anterior chain. Posterior cervical chain. Supraclavicular ones. Looking for skin turgor is very good. I'm thinking, oh, can you shrug your shoulders? Very good. So that was 11. And now I'm going to listen to your lungs. I'm going to start in the front and afterwards going to go to the back. And take a deep breath. In real patients, I would put it directly on the skin. Deep breath. Okay, I'm going to go to the back. Before I continue listening, I'm going to just inspect her back. The skin coloration looks good. There are no evident bumps or lumps on it. Do you have any pain when I touch here? No?
No.
Can you bend a little bit forward? Her spinal curvature looks Good, it's straight. I might hurt you a little bit on this next procedure. You tell me if it hurts, okay? Any pain there?
No.
Any pain there?
No.
Very good. And now I'm gonna percuss. Okay, that sounds tympanic, resonant, that's good. I'm going to listen for breath sounds. Can you please take a deep breath again? Okay, and out. Very good. Excellent. Very good. Excellent. Very good. I'm going to come back to the front. I'm going to look at her upper extremities. The skin looks good, temperature looks perfect. Fingers are okay. Can you push up for me and push down? Can you squeeze my hands? Okay. I'm going to look at this pulse. And I'm going to compare to this pulse if it's about the same. And it is. I'm going to look at capillary refill on both sides, and it's less than 3 seconds, and that's perfect. Can I ask you to close your eyes and tell me if you feel this?
Yes. 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 Yes.
Perfect. Now I'm going to ask you to lay down, and now I don't see why you want this up.
No, that's all right.
There we go. This is an old one we have, ma'am. I'm sorry. It will stay up. You can
Is
lay
it
down.
safe?
It's safe. Okay. Now I'm going on to the abdomen. I'm first going to inspect. Her abdomen looks flat, slightly rounded. No abnormalities, no bruising. I'm going to auscultate for bowel sounds. And they are present. And present in the lower quadrants as well. Now I'm going to turn and listen to vascular sounds. So I'm going to listen to the aortic sound. No bruits, the renals. I don't hear any bruits here. The iliac. And the femorals I'm going to skip. I'm going to go to the heart, and I'm going to listen to the aortic sound, first with the diaphragm, and then pulmonic. I'll listen to the tricuspid on the 4th intercostal space, on the left sternal border, and the mitral on the 5th intercostal space, mid-clavicular line. I'm going to repeat the same thing with the bell to listen for murmurs. No murmurs. No murmurs. No murmurs. So I can hear S1 and S2, no clicks, no murmurs. And also if I want to palpate the pulse of maximum impulse, it would be at the 5th intercostal space, mid-clavicular line. And now I'm going to go to the legs. I'm looking for edema, looking at skin coloration. I'm going to look for pulses. Maybe one side and then the other. I'm just comparing one side to the other. Also the dorsalis pedis, very nice, strong on both sides. I will look for capillary refill. I will look if she is strong, if it's a 501.5. Can you lift this leg? Okay, and how about this leg? Very good. And I will do the sensation. And I'll ask her if this is sharp or if this is dull. And through her genes, she won't be able to feel it, but I'm going to ask her anyways. So I'm going to tell you that this is sharp, this is dull, and this is sharp. Okay? And try to distinguish it. If she does it wrong, it's because it's the genes. How about this one? Sharp. And this one? Sharp. This one,
Dull.
this one,
Dull.
this one.
Sharp. Dull.
Okay, very good. I'm sorry about that. And now I'm going to last do the reflexes, the Babinski reflex, which in a normal person I wouldn't do, but if I'm looking at a comatose person, I would do it. So the Babinski reflex, that's okay. And there we are, and I'm done. Is there anything I forgot?
Yes.
Hearing. The abdominal area isn't, I mean,
I missed that.
Yeah.
There you go.